Hello and welcome to the Maunder Beauty Academy Allergy Awareness Masterclass. In this masterclass, we're going to be talking about the types of allergies that can occur through our treatments. We're going to be talking about how they sort of manifest within the body, so what sort of symptoms we'll be able to see, how to deal with these allergies when they do occur, and we're also going to talk about how to protect our clients from allergies, how to protect ourselves from allergies, and also how to protect our businesses in the event that an allergy does occur and in the event that a claim is brought forward against us as well. Grab a notepad, grab a pen, grab a cup of tea, and let's get right into the masterclass. So firstly, let's talk about what an allergy is and why they can occur. So reactions are caused by hypersensitivities in the immune system. So our immune system is basically saying, oh my God, what is this product you've put on me? Something that's touched or gone into the body, your immune system's going, whoa, we don't like this at all. So it begins to attack. Basically a hypersensitive reaction to something that your immune system thinks is going to hurt you. So reactions can be caused by skin contact with a substance, injectables, anything that's injected into the bloodstream directly. It can be caused by breathing something in, such as a spore or an allergen within the air, such as hay fever. They can also be caused by ingesting, so eating something as well, so food allergies. Allergies can range from very, very mild, so something along the lines of a little bit of skin irritation, itching, a very small localized rash, or they can go anywhere up to more severe reactions which will require immediate medical attention, such as swelling of the airways, difficulty breathing, swelling of the eyes, etc. The likelihood is for us as therapists, any client that does react generally will have a mild reaction. And that is something we need to be on the lookout for, because these allergies do accumulate over time, and that is what will cause then a more severe reaction generally. Of course, this is just a blanket statement. This is not every single client. Every single client will be different. So allergies can accumulate over time. So for some clients, they will start out with a very mild reaction, and so such as a small area of skin that is sore or itchy or flaky, for example, or in terms of lash and brow treatments, it could be just itching of the area, it could be watery eyes, it could be excessive sneezing after they've had their lashes done, for example. This is a very mild reaction to substances that have been placed onto the body, and a lot of people do get these with no further consequences. However, it could be something that's going to lead on to something more serious, so something more like an anaphylaxis type of reaction. So what we want to be avoiding is accumulating that product onto our client and then causing them further reactions in the future. So a perfect example of this is one of my clients had individual lash extensions. She had the full set the first time, no reaction whatsoever, everything was fine. She had an infill a couple of weeks later. After her first infill, she had a little bit of itching of the eyes, and that was just sort of for a couple of days after she'd had them done, so she didn't think anything of it. She then had another infill, and the next day her eyes swole, they were large, they were inflamed, they were red, they were sore, and she had quite a severe reaction to that. She's a perfect example of a cumulative allergy. You know, literally 3 sessions, it was nothing, mild, severe, and that was it. Unfortunately, she's not able to have lashes anymore. It's just the way it is, unfortunately. Client has reacted once, they're going to react again. The only time you would be able to then continue the treatment, so again, for example, lashes, would be if they can actually isolate the ingredient that they're allergic to. So if they were, for example, allergic to the black pigment in a lash glue, you may be able to use something like a clear lash glue instead. So that would be something they would have to go through with their doctor and decide exactly what they're allergic to. That's something they'd have to have done in the medical sense, some testing, etc. It's also important to note that allergies can happen at any time. So whether a client has not had the treatment before or whether they've had it 100 times before, they could still have an allergic reaction to the treatment. This can even happen in the case of somebody having a patch test and you know, they've had their patch test 24 hours before their treatment, then they come for their treatment and then suddenly they have a reaction. So this can happen. So even if you've done your patch test 100% correctly, you've done all the procedures correctly, it can still happen. It's not your fault, it is just science. Okay, so it's time to get into some of the science behind allergic reactions now. So we're going to go through the 4 different types of allergic reaction that somebody can have. Type 1 is anaphylactic reaction. So this is very severe. It requires immediate medical attention. So some of the symptoms include difficulty breathing, swellings, low blood pressure. People can they can be quite pale, they can feel faint, be a bit lightheaded, etc. When they sit up, they might feel very lightheaded and faint. So it's one of the first signs of low blood pressure. They may have bluish skin and they may actually be in shock as well. So in the case of someone who has suffered anaphylaxis, just call 999, just get them to the hospital. We're not trained to deal with stuff like that. Type 2 is a cytotoxic reaction. This is quite often seen within autoimmune conditions where the immune system is already compromised and the body reacts to things that it wouldn't normally react to in an adverse way. So this is where cells are damaged by antibodies. Type 3 then is an immunocomplex reaction. It manifests in sort of swellings to the area. An obvious example of this would be something like an insect bite where the area just swells up. It can also affect the lungs, the kidneys and the skin as well, so causing bumps on the skin, so rashes, etc. And then type 4 is a cell-mediated reaction. So this type of reaction takes a little bit longer to show. So this would be the type of reaction that takes over 24 hours. Typically, it's between 48 and 72 hours that you will actually see symptoms of this type of reaction. Something that would be seen quite often in a fungal infection, some skin sensitivity, so to metals, etc. as well. All the other types of reactions, so the first 3 types of reactions, so anaphylaxis, cytotoxic and immunocomplex, will all show up within around 24 hours. What should we be doing if a client reacts to a treatment? Let me tell you something we should not be doing, and this is something that I see so often, asking these questions about what do I do, my client's had a reaction. The amount of therapists that will recommend that you give them medication or tell them to take medication. We are not medically trained. We are not to give them advice about what to take. That includes saying to them, take an antihistamine. So as general as that, we are not allowed to tell them take an antihistamine and you'll be fine. We are not medically trained. We are not to do that at all. Please stop doing that, please. The reason we are not allowed to do that, not only because we don't have the training, we're not insured to do that, is because imagine they're on a medication that actually doesn't react well with antihistamines. We don't want to be advising them to take something that then is going to harm them because we don't know. We are not trained in different types of medication. You know, they could have a condition where they're not able to take antihistamines. We don't know. So it's not worth the risk of telling them for yourself or for your client. So in the event of a mild reaction, I'll be applying a cold compress to the area. So whether I do that or whether they do that at home themselves, if they've already left me, I would be recommending that they visit a medical professional, so whether that's a GP or whether that is a pharmacy. I would firstly recommend a pharmacy to save them making an appointment, etc. Usually the pharmacy will be able to give them something over the counter which will reduce the reaction. Also recommend, if possible, if it's something you've applied to the skin, for example, try and remove it before they leave. Or if it's lashes, then I would be advising that you remove those lashes. What we want to be doing is trying to avoid adding extra chemicals to the area. So if you've got to remove lashes, I would recommend using the banana peel method. So peeling the lashes off. Yes, it's time consuming. Yes, it's annoying when you've just done a new set and you've got to peel them all off. It is necessary. We don't want to be adding more chemicals to the area and irritating the area further. We don't know how that's going to react with the client. If they've already reacted to one thing, the likelihood is they could react to something else. If the client does have a more serious type of reaction, swollen eyes or onycholysis where the nail is lifted from the nail bed, etc. in terms of nail treatments, then I would be recommending removing all products. Try and do it without chemicals where possible. With the nails, I would personally, I would prefer to use an acetone than actually file off any gel polishes and things like that, purely because the irritation to the nail and the actual pull on the nail as you're filing is going to cause more damage than we want to cause. We want to make sure that we're washing the hands thoroughly afterwards as well, to make sure that there's no residue left on there. Leave the product off. They're not going to be able to have it again because they are now allergic to it, unfortunately. So with a more serious reaction, first things first, I would be recommending that they go see their GP. Definitely, you know, either a GP or A&E if it's that severe. And it goes without saying, if a client does go into any sort of anaphylactic shock, if they're having severe breathing difficulties or any breathing difficulties, if they have severely swollen eyes, if they come up immediately, for example, and they're getting bigger and bigger, or if their mouth starts to swell, their tongue starts to swell, anything like that, if they're particularly lightheaded, or you know, if they're feeling faint, or if they do actually faint, or if they're, you know, in shock of some sort, just call 999. It's not worth the risk of leaving it and seeing. Just call 999 and let them deal with it, because, you know, it could be very serious. So we've talked about client allergies, but what about therapist allergies? So as therapists, we are exposed to a lot of chemicals a lot of the time, more than a lot of people are. So it's definitely worth trying to minimize our exposure, minimize the risk to us of getting allergies in the first place. So here's a couple of tips for you. So always try my gloves as much as possible. We don't want anything touching the skin where possible, including gel polishes, etc. They're not meant for the skin, they're meant for the nails. Wear a mask wherever possible. Of course, at the moment we're all wearing masks because of COVID, so that's absolutely fine. You may want to switch to something which is more of a chemical grade mask for fumes and things like that. You may want to do that if you're suffering with your nasal passages, etc. Try and keep your products away from underneath your nose. So I'm talking about lash glue here, okay? So if you've got a lash glue ring, then when you're doing your client, your hand's up here, it's right under your nose, you're sniffing all those fumes up. It's not very pleasant. I know when I do a set of lashes, even with a mask on, I find that it all goes up my nose and I can't breathe for like 3 days afterwards. This is why I always recommend a jade stone, because then you can keep it sort of away from you a little bit to the side rather than directly underneath the nose. Try and make sure that your area has got good ventilation, so whether that is some sort of air conditioning unit or whether it's just the windows being open where possible. Try and avoid residual fumes by having a bin with a sealed lid, so something that will hold those fumes in there. And I think it's really important just to be aware of the symptoms of a mild reaction, so things like a runny nose, things like sneezing, irritation, itching, dry skin patches, sore skin patches, and dermatitis type reactions on the skin as well. All these things are very mild reactions, but could then lead into something more serious, which would mean, unfortunately, you may not be able to do your job anymore. So it's very important to be aware of them and try to minimize the risk as much as possible. So how are we going to protect ourselves from reactions as much as possible in terms of our business? The first thing, the most important thing, patch tests. It's probably been drummed into you 1,000 times, but seriously, the amount of therapists that do not do patch tests, it infuriates me. It is mandatory to patch test for tinting, for lash lifts and brow lamination. So make sure you are doing your patch test for every single product that comes in those packages. Why would you not? I just don't understand why people don't do it. Not only are we protecting our clients, we're also protecting our businesses as well. If you've done your patch test and then your client happens to react to their treatment after having a negative patch test result, you've done your job. Lash extensions are different in the sense that not all manufacturers require you to patch test for lashes. And the reason for this is the amount of glue that you're actually using during a patch test is not really enough to cause a reaction. I mean, it can, of course, if somebody is severely allergic to it, but if somebody's got a very mild reaction, they may not notice it from just a couple of lashes on each eye. So check with your manufacturer, check with your insurer as well, because they may say, actually, we require you to do a patch test, even though the manufacturer says no, but usually they'll say follow manufacturer's instructions. So always check manufacturer and insurance, check them both. We've done our patch test. We also want to do a consultation with our clients. And by consultation, I don't just mean have a chat with your client and talk about what they fancy having, how they want them to look, or what colour they want, or those sorts of things. That's all great and that is important information. But by consultation, I mean a written form that they fill in, which has all their details on, contact details, medical information. It needs to have their medical history, medications that they take, anything that they're using on their skin, anything that they're using on the area to be treated as well. It also needs to have their patch test date on it, and they need to sign it. You need to sign it. It needs to be signed by both parties. It needs to be basically agreed by both parties that the information is correct as far as we know. If something did arise, so if they did have an allergic reaction, you've got your evidence. It may be that they've had a patch test and it was fine, and then unfortunately they've just reacted. Very unfortunate. Doesn't happen often, but it can happen. It may be that they haven't told you that they've had a reaction in the past, because that's really important. This is why it's also important to ask your clients, have you had the treatment before? What did you think of it? Did you like it? Did it work for you? Your consultation form, signed by you and by your client, will act as your defense. It will be your sole defense in the case that they do bring you to court for any particular reason. So make sure that you have a consultation form. I'm just going to put out there too, waivers do not stand up in court. Waivers do not mean a thing in court. So if your client comes to you and says, it's okay, I've been having tints for years with so-and-so down the road, so what? Patch test them. The reason being, they might be using a different product to you, which may have different ingredients that they are not allergic to, and then suddenly your products may be completely different. You go to court, it does not matter. They will not take it into account. You are the professional. You should know better. That'll lead us nicely onto insurance. So I would definitely recommend getting a beauty-specific insurer. And the reason for this is, if a claim was ever brought up against you, then you would have somebody on the other end, so on the insurance end, who actually can see it from your point of view as well. There are insurers who will insure you. They are generic insurers. They also offer home insurance and car insurance, etc., etc., etc. So they do all of that. They don't necessarily have beauty experts or beauty specialists within their team. So when you call them, you will speak to a generic business insurance advisor. So they won't necessarily know anything about the treatment you're doing. They won't necessarily know what the procedures are, so what the correct procedures are. All they will say is, did you follow your manufacturer's instructions? Did you follow your training? And that's it. Whereas a beauty specific insurer will be able to give you advice. They will be able to tell you what is right and what is wrong. They will be able to help you in that sense. I also personally have found them much better in communication. So if I ever need to ask them anything in terms of, like, we've had a lot of things with the coronavirus, and I wanted to get confirmation that I was allowed to open and I was allowed to carry out close contact services, etc. So I found that it was really, really helpful to have somebody who actually understood what I was doing on the other end of the line, rather than somebody who just goes, yeah, I'm sure that's okay. I mean, I'm sure it's fine. Where actually it may not be fine because of the way we do things. So by getting a beauty specific insurer, you will have somebody who knows the industry, you will have somebody who knows it from your point of view, and they are more likely to help you if they know what you're talking about. If you do ever have a client who threatens to make a claim against you, or who does have a severe allergic reaction and you think, oh, they might try and sue me, I would always contact your insurer and just let them know. Usually they're really, really helpful. Obviously it does depend who you're with, but generally they'll be very helpful with you, and they'll be able to advise you on what your next steps should be, and they may actually be able to prevent a claim from taking place by giving you that advice. But yeah, always talk to your insurer, because then they will at least be prepared if that client does then choose to make a claim against you. Thank you so much for watching this masterclass. I really hope that it's been helpful and informative. I hope that it might have helped some of you who maybe haven't implemented these things in your business, and maybe it's something that you now will implement, which I really hope so, because I think that we need to improve the standards in our industry. There are so many people that are not doing these things, not necessarily through fault of their own. They maybe don't even know that they should be doing these things. So I really hope this has been helpful, and I hope that if something does ever arise, so such as a reaction from a client or from yourself, I hope that you will now know how to deal with it. And yeah, I hope that this has been super helpful. If you do have any further questions, please do DM me, let me know. And yeah, I will speak to you all very soon.